So with that, can we enhance opioid receptors and enhance these receptors predominantly in the peripheral nervous system? And one strategy we used is the introduction of a virus which had a gene, a vector, and the strategy was to attempt to increase the opioid receptors. A number of different strategies have been used, a number of different viruses have been used. We used herpes simplex virus because this is a virus that uses the nervous system to transport itself. So one can inject these vectors in the periphery, and they get transported from the periphery towards the dorsal root ganglion. And a number of different strategies, again, have been used using these vectors. One strategy is to increase the body's ability to synthesize endogenous opioids. We used a viral vector with a cDNA for an opioid receptor in an attempt to increase the number of opioid receptors in the periphery. So here's a strategy. So you inject the viral vector in the skin. They get transported along the nervous system into the dorsal root ganglion. And then what they then do is in the dorsal root ganglia, they get incorporated into the neurons in the dorsal root ganglia. And then there are more receptors at the level of the spinal cord near the terminals of these receptors, and possibly also in the periphery where these terminals are. So the idea was here these herpes simplex viruses vectors are neurotrophic, so they can be transported along this pain signaling pathway, and they can enhance or increase the expression of these receptors for long periods of time. So if our hypothesis was correct, what should happen is these viral vectors should be incorporated into the dorsal root ganglia. They should be transported towards the periphery, so we should see more receptors here. This should be transported towards the spinal cord, and we should see more receptors at the level of the spinal cord as well. And this is what we saw. So here is the dorsal root ganglion, and we saw that when we had these viral vectors in the appropriate direction, which is called the sense direction, you could see more number of neurons in the dorsal root ganglia that had these mu opioid receptors. And when we reverse this direction in an antisense direction, we could reduce the number of opioid receptors, or number of cells that had the opioid receptors in the dorsal root ganglion. We also looked at the amount of the expression of the opioid receptors in the spinal cord, and using these viral vectors, we could show that in the dorsal horn of the spinal cord, in comparing the control viruses with the this is the mu opioid receptor virus, this is the control, you could see that we could have a greater amount of expression of opioid receptors in the different layers of the spinal cord. So in essence, we've increased the number of mu opioid receptors in the spinal cord and the dorsal root ganglion after the use of these viral vectors. So the question is, are these vectors and the increased expression, does it lead to a functional change? Does it lead to improved analgesia? And to show that, we could demonstrate that the pain threshold, so here is amount of power withdrawal thresholds to mechanical stimuli, compared to the control, the mu opioid receptor viral vector treated animals had fewer withdrawals. That means they were less responsive to the same number of stimuli. And in addition, when we administered morphine or exogenous opioids, such as in this case, a peripherally limited opioid, loperamide, we could show that in comparison to the dose response curve for the control, the amount of analgesia that we could obtain with the loperamide was shifted to the left. That is, with a lower dose of the exogenous opioid, we could produce more analgesia. So here, using these viral vectors, we could enhance the effects of peripherally administered opioids. Okay. So we heard a lot about this pungent active ingredient in chili pepper, capsaicin. So we used a model where we treated these mice and rats with capsaicin injected into the paw and looked at their pain behavior, paw flinching behavior. And we could show again that in comparison to control animals, the amount of flinching that was seen in these animals that had this mu-opioid receptor viral vector introduced was reduced. And not only was the behavior to the acute administration of capsaicin reduced, but also the hyperalgesia to, in this case, heat stimuli was less in these mu-opioid receptor viral vector treated animals compared to control animals. So we could reduce the pain to capsaicin, and we could also reduce the hyperalgesia associated with the capsaicin. So to summarize things about neuropathic pain, neuropathic pain is common, and unfortunately there are few therapies that we have in our armamentarium. We demonstrated by clinical studies that opioids are effective, but a number of their side effects, such as the central nervous system side effects, cognition, dizziness, sedation, are limiting factors. That we've gone back to the bench to look at strategies to improve the balance between efficacy and adverse effects. And one strategy that we've used is the use of viral vector strategies to enhance the expression of mu-opioid receptors at peripheral sites. And the mu-opioid receptor viral vector animals showed reduced pain and enhanced peripheral analgesia. We are in the process of examining whether the same strategy would be useful in animals with neuropathic pain, in models of neuropathic pain behavior. So the question you can ask is, is this translatable to a patient? Here is a elderly woman with post-operative neuralgia. She had a shingles which just affected a couple of dermatomes here. When you examine her, just touching the skin and the whole of the back is painful. So this is the area where she says, it's extremely sensitive and she can't tolerate clothes. And she says, I walk around in my house without wearing anything above my waist. So the answer is we still don't know. Can these observations be translated to improve pain management of neuropathic pain in patients? And that's what we hope to find out in the next coming years. Thank you very much.